Our last guest today, Nina Lopatin. She is an audiologist with direct hearing with us on the Oakland County Megacast. Nina, thank you for being with us today.
My pleasure. Thanks for having me.
Appreciate having you on. How are you? How's your team over at Direct Hearing?
I am the team, Tyler. My team is great. Thank you very much.
Well, we are glad to hear that. So over the course of the pandemic, how has business been? Are you still seeing a regular number of patients coming in? Has that been reduced, or maybe has that been reduced and now it's flowing back in slowly but surely?
Oh, flowing back in, surely, truly. During the pandemic, I was able to help my patients by doing curbside audiology. I really strongly feel that hearing is an essential service because staying connected is so vital, especially now for seniors and people with hearing loss who are feeling so incredibly isolated. So during the pandemic, I did help people. I would go car side with my mask and my gloves, pick their hearing aids up. They come up to my office, clean and check them, make sure they're working well, and take them back to them. Since beginning of July, I'm currently seeing patients in my office, and I am doing a lot of COVID-19 protocols to make sure that they are safe.
So, Nina, during this pandemic, you talked a little bit about the isolation, but how has this been for your patients with everyone having to wear a mask? Does that increase their feeling of isolation?
I don't think that increases their feeling of isolation, Ronnie. It's more the difficulty understanding what people are saying, honestly. The isolation is not referenced to necessarily wearing a mask, but they are struggling more because the masks reduce the loudness of the person they're speaking with, and they're not able to read lips. I've gone to the extent of ordering 3 or 4 different varieties of masks with clear mouths just so my patients can see them. And they are helpful, and I believe that patients appreciate them.
Nina Lopatin with us. She is an audiologist at Direct Hearing with us on the Oakland County Megacast. So when I think of an audiologist, and when many people maybe think of an audiologist, they think about it on a very basic level. They're thinking about when you go in for a hearing test for school or for a job or whatever the case may be. But there's so much more that goes into audiology and that practice that's really helpful for people. Could you explain a little bit for those that have a novice's point of view, just what audiologists do provide to their patients?
Myself at Direct Hearing, what I provide are comprehensive hearing evaluations at no charge. I can give you the perspective from my practice and then go into the profession as a whole. If next steps to better hearing include trying hearing aids, I provide a 2-week hearing aid test drive, which is risk-free and commitment-free. I also am able to do hearing aid repairs and modifications with my on-site lab. I do ear mold impressions for custom hearing protection products, including noise, swim, hunting, and musician earplugs. The profession as a whole is so much more vast than people realize. As you mentioned, Tyler, audiologists do balance testing and vestibular testing. Besides hearing aids, we work in operating rooms, monitoring evoked potentials during surgeries, neonatal intensive care, screening of infants. Every newborn is now screened for hearing loss, which needs to be followed up. So, as you said, the field of audiology is so much more vast than people do realize.
And people don't realize either just how much impact that their hearing and that the health of their hearing has on the rest of their body. You mentioned that audiologists do a lot of work with balance. How is the body affected by hearing ailments or by injuries to the hearing systems?
Hearing is broken down into a couple of parts, hearing and understanding. So which kind of makes sense. When we do test hearing, we test different frequencies across a range and across loudness, But then we also test understanding ability, which is separate. Just because you hear someone talk doesn't mean you understood what they said. And typically, as hearing decreases, the ability to understand speech also decreases because you're not hearing those sounds as well. So that's hearing and understanding. Please remind me of the rest of your question.
What are other ways that your hearing can have impact on the rest of your body's health?
Well, your balance system you were referring to, your balance system is in your inner ear. They are separate nerves to the brain, when your hearing decreases, your other senses also need to be more intense. So older people who have decreased hearing and also have decreased vision, it's a matter of psychologically isolation, to be honest with you. When you talk about overall well-being, I think that that's important to note that when you're not hearing and contributing to conversations and interactions, especially people with dementia, it's so important for them to be connected so they can be part of the conversation and feel connected to the world.
So a lot of schools are getting ready to go back to class in the fall, but they're still doing remote learning. How has this impacted, or kids that have to learn virtually? Have you seen patients that are kids come in that are having a hard time keeping up because they're not in the classroom setting?
I'm sorry, I cannot address that, Ronnie, because most of my population, I would say, is 40 plus, and I'm not involved with the school age population. Well, Nina, I want to talk to my expertise.
Well, thank you for that clarification, Nina. So on that topic, though, with people that are working virtually and they are at home, they're engaging more with technology, which means they're much like I'm doing here and Ronnie's doing here. We're wearing headphones, or we're wearing earbuds, and we're adjusting volume controls on all of these devices all throughout the day sometimes, and just a constant stimulus through the ears. Have you noticed that that's had an impact on people's hearing health over the course of this pandemic?
I cannot tell you the specific research articles, white papers, or whatever regarding hearing loss, noise-induced hearing loss due to the use of earbuds and headphones. It only makes sense that if you expose yourself to loud music, loud sounds for long periods of time, you are going to affect your hearing, bottom line. Noise-induced hearing loss we see a lot in regards to hunting and shooting and work in factories. I see a lot of peers who have gone to a lot of concerts having noise-induced hearing loss. So yes, with the earbuds and the headphones and things like that, there is a greater chance of noise-induced hearing loss. What you mentioned, Tyler, in terms of connectivity, one benefit of hearing aids is the technology has allowed us to connect hearing aids to cell phones. And the reason that that is vital is that the patient can actually hear the phone conversation, not by holding the phone up to their ear, but through their hearing aids. And being able to hear the phone through their hearing aids, especially both ears, really improves their understanding ability and their ability to connect with their loved ones.
Can you talk a little bit about some of the newer technology and how it's helping in your industry?
Sure, absolutely. So you understand about hearing aids. Hearing aids are programmed to a patient's hearing loss. They are incredibly complex computers. And think about what the goal of wearing a hearing aid is. It's to help you focus and to hear and understand speech in very difficult or challenging listening environments. What are those? That's when you're, it's not necessarily one-to-one with a person sitting across from you at a desk. It's when you're in that business meeting. It's when you're traveling in the car with two kids in the back seat and the person in the passenger seat is trying to tell you where to go and how to get there. It's in a crowded restaurant with a table of 6 and trying to follow the conversations around the table. So the technology that is available is very sophisticated. It's also very natural sounding. And the levels of technology have so many automatic adjustments that the hearing instruments do when you change these environments, like walking from perhaps a quiet car to an outdoor gathering. They smoothly change how they amplify speech and sound based on your environment. If it's quiet all around, like in the car, and then you're in an outdoor gathering with sounds coming and speech coming from all different directions.
Nina Lopatin with us. She is an audiologist at Direct Hearing with us on the Oakland County Megacast across the local area on our family of TV, radio, and other media outlets. So circling back to technology's impact on people's hearing health, especially during the pandemic when they're engaging with more technology. Maybe people are home for longer periods of time, so they're listening to more music. Musicians maybe are playing more music, and so on and so forth. That can also take a toll on people's hearing health over time. And there's things that people do in regular times as well that often are detrimental to their hearing. What are some tips that you have or some advice that you have for people to maintain the health of their hearing and prevent hearing loss?
Well, the first thing I would say is get a baseline hearing test. So you know where you're hearing at this time, at this point in time. The reason a baseline hearing evaluation is so important is because you don't know what you're missing. Okay, so when you know where your hearing stands at this point in time, that's a good start. Only makes sense, Tyler, that you listen to your headphones, your earbuds at not quiet, but normal listening levels. Normal is different for everybody. You try to take it down a few notches just so you can understand comfortably. Hearing health. What else about hearing health? Nothing sharper than your elbow in your ears. Please do not use Q-tips to clean your ears, because all that does is make my life and other people's lives more difficult trying to get it out. So be kind to your ears and your ear canals, and nothing sharper than your elbow in your ear. And tune it down. Be reasonable.
So, Nina, is there a certain age that you recommend people get a hearing test? Because a lot of adults haven't had them since they were probably kids.
Yeah. If you suspect you are having an issue hearing and understanding, you probably are. The other issue is on an age per se, 40, 45, if you're struggling. On average, Ronnie, it takes 7 years for a person with hearing loss to come in for testing. And that's usually because family and friends are, egging them on and saying, you're having difficulty hearing and understanding. Well, if your family's talking to you and suggesting that there might be an issue because you're constantly saying what, that's a good time. You don't need an age. You need feedback from your family, and know that you are asking people to repeat. You're turning up the TV louder than other people. You have ringing and buzzing sounds in your ears, which is called tinnitus. Or, as we talked about before, you're feeling stressed and tired from working so hard to hear and understand. Those are all signs of hearing loss, which you can use to make a good choice to come in.
So aside from what you do, you did mention that you were a team of one. How, as a business owner, have you managed to survive, and what were some of the biggest struggles for you to make it through?
I am very blessed and very fortunate to have my practice within my husband's CPA office. So we share expenses in that way. I have an incredible patient base who are fabulous at supporting me by referring friends and family, which is the greatest compliment, and I'm very grateful for that. I am catching up, or I am caught up from the people who have come in. So I think I'm in a really good place in terms of the pandemic. It gave me a chance to learn techniques for infection control and client and patient safety, and safety for me. So I think that we have weathered the storm well, and I like the fact that even post opening up, after opening up, I'm going to continue to do car side or curbside audiology. And I think that that's a real positive too, Ronnie.
Well, that's really great to hear, Nina Lopatin, audiologist with direct hearing, that you've made those pivots, you've been able to survive through this pandemic, and that your patients are doing a great job in supporting you and supporting their health as well. So just another couple of minutes with you before we let you go. It caught my ear earlier on in the interview, no pun intended, okay, maybe a little bit intended, when you said nothing's sharper than your elbow when you're putting something in your ear to clean your ear. In that situation, what should people do? What can people do to clean their ears out safely and help their hearing without being a detriment to you, of course, and your services, and of course to their own ear canal health?
Well, ideally, your ears are supposed to be self-cleaning. So in other words, any wax that you produce is supposed to move itself out gradually. You really, before you do any treatment, you need to make sure that your ear canals are healthy and that your eardrums are intact. So I'm not going to recommend anybody put anything in their ear until that they know that that's the case. People who have ventured into their ear canals realize that they are incredibly sensitive. So if you scratch your ear canal with a Q-tip or anything like that, you're gonna really be uncomfortable. So Tyler, I would give an approach to cleaning your ear canals, yet I hesitate based on people needing to know that their eardrums are intact and it wouldn't affect anything else. So I'm gonna err on the side of caution.
That's always a good idea, to err on the side of caution. Nina Lopatin, just another minute or so with you. Anything else that you think is important for our audience to know, for people to know about their ear health, or any other information you'd like to touch on today?
Well, as I said, a baseline hearing evaluation is so important at any time in your life because you don't know what you're missing. And we talked about the signs of hearing loss. If you have any question at all, what harm is there in coming in? I do not charge for it because I feel so passionately that people need to know where their hearing stands at this point. And listeners need to know and understand that hearing is so important in keeping them connected with their friends and family, which leads to better, warm and fuzzy feelings and positive outlooks on life.
Well, Nina, we appreciate having you on the show with us today.
My pleasure. Thanks for having me.